In this lecture, we will study about the anatomy of muscles of mastication, their structure, functions, and clinical relevance. What are the muscles of mastication? The muscles of mastication are a group of four paired muscles, responsible for chewing and jaw movement. The muscles of mastication play a critical role in jaw movements, essential for chewing and speaking. What is innervation of the muscles of mastication? The muscles of mastication are supplied by the mandibular nerve, which is a branch of the trigeminal nerve. The four muscles of mastication are Masseter muscle, Temporalis muscle, Medial Pterygoid muscle, Lateral Pterygoid muscle. We will discuss them one by one. Number 1. Masseter muscle. It is a superficial muscle, located at the lateral aspect of the mandible. Its origin is at the zygomatic arch. Its insertion is at the lateral surface of the ramus of the mandible. It performs two functions. It elevates the mandible. This closes the mouth. It assists in minimal protrusion. Number 2. Temporalis muscle. It is a broad, fan-shaped muscle, located in the temporal fossa. Its origin is at the temporal fossa, in temporal fascia. Its insertion is at the cranioid process of the mandible. It performs two functions. It elevates the mandible. This closes the mouth. It retracts the mandible. Number 3. Medial Pterygoid muscle. It is a deep muscle, situated on the medial aspect of the mandible. Origin. Its origin is at two heads. Deep head attaches to medial surface of the lateral pterygoid plate of the sphenoid bone. Superficial head attaches to maxilla and palatine bones. Its insertion is at the cranioid process of the mandible. It performs two functions. It elevates the mandible. This closes the mouth. It retracts the mandible. Number 4. Lateral pterygoid muscle. It lies horizontally within the infratemporal fossa. Its origin has two heads. Superior head attaches to infratemporal surface of the sphenoid bone. Inferior head attaches to lateral surface of the lateral pterygoid plate. Its insertion is at 2 points. Neck of the mandible. Articular disc and capsule of the temporomandibular joint. Function. It performs three functions. It protracts the mandible. It depresses the mandible. This opens the mouth. It contributes to side movements of the mandible. Which muscles close the mouth? Temporalis muscle, Masseter muscle, and medial pterygoid muscle close the mouth by elevating the jaw. Which muscles open the mouth? Lateral pterygoid muscle opens the mouth by depressing the jaw.